Indiana Newsdesk is made possible in part by Smithville Fiber, the Gigacity Company, fiber internet, HD, and digital IPTV in Southern Indiana. More information at smithville.com. Mallard Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis, lawmg.com. The IU School of Education, preparing teachers, scholars, and administrators to improve teaching in Indiana and around the world. education.indiana.edu. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. The Radio and TV News Endowment, a fund established by listeners and viewers to sustain reporting of Indiana news. More information at indianapublicmedia.org/support. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. 6 months after President Trump declared the opioid crisis a nationwide public health emergency, those working on the front line want to know what's next.
We don't have time. Honestly, we don't have time.
The legislative session is ending soon. We'll catch you up with what's happening at the statehouse. Some rural counties are spending hundreds of thousands of dollars a year to repair roads. But these potholes aren't your standard Indiana road damage.
Probably roads in at least half of the county now that are seeing some damage.
Coming up, how county officials and Amish communities are working together to preserve the roads. Plus, we'll go to Orange County, where one man is planning on taking extreme measures to deal with vultures buzzing around a small town. Those stories, plus the latest news headlines from across the state, right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Well, it's been about 6 months since the Trump administration declared a nationwide public health emergency due to the opioid crisis. But many are wondering what's changed. Trump says federal leaders will roll out a policy plan in the next few weeks. As Lindsay Wright reports, local advocates hope to see less talk and more action.
Overdose Lifeline has been at the forefront of the opioid crisis in Indiana for years. Up until recently, founder Justin Phillips says the group was crammed into a small space with little storage.
We just, had outgrown the space we were in because we've got intern participation from both Purdue and IU and added a staff so we could fully implement our prevention program. Okay, here we go. Space. Yep.
The organization moved into a larger space about a month ago, so they can continue helping those impacted by the opioid epidemic.
We had the naloxone off-site in a secure storage. Now we can do it here, which is so much better for us.
And still, more than 100 people in the country die every day to an opioid overdose. Drug overdoses in Indiana are growing faster than the national average, and death rates involving synthetic opioids doubled between 2015 and 2016. Phillips says we can't keep talking about the issue. It's time to act.
We don't have time. Honestly, we don't have time.
National leaders promised more action at a White House opioid summit last week. And you might recognize some of their faces, including former Indiana Health Commissioner Jerome Adams, who's now Surgeon General.
My brother Philip is in prison due to crimes he committed to support his addiction. His illness has affected my entire family, emotionally, medically, and financially.
Health and Human Services Secretary Alex Azar says they've been working to increase treatment and implement prevention and response efforts. He says states can also get waivers for Medicaid to cover medical-assisted treatment like methadone or Suboxone. He says it's essential. He also says Trump's budget proposes doubling state grants for prevention and treatment from $500 million to $1 billion a year starting in 2019.
To support that grant program, we announced a new method of technical assistance in November to use more local experts and expertise to provide technical assistance to states and grantees rather than a traditional one-size-fits-all approach from Washington.
Associate Professor Dennis Watson says that's what it's going to take to actually make a difference, and Indiana needs to hold national leaders accountable.
things at the national level, you know, they can trickle down somewhat, and they're going to states in terms of like policies that make certain funding available and things. But at the end of the day, it's the states figuring out how to use it.
Watson says research shows opioid use decreased by more than 30% within 6 months for those using medication-assisted treatment. But he says people need social support too.
You know, if you don't have a job and you don't have a car, how are you going to pay for treatment and how are you going to get to treatment? So, and those are the things that we leave out of programming.
HUD Secretary Ben Carson touched on the lack of sustainable housing options and other social barriers for those with addiction. President Trump suggested harsher penalties for drug dealers and even opioid distributors.
Hopefully we can do some litigation against the opioid companies. I think it's very important because a lot of states are doing it. But I keep saying if the states are doing it, why isn't the federal government doing it? So that'll happen.
Several Indiana counties have announced lawsuits against opioid manufacturers. While officials continue discussing the issue, Phillips says her organization is trying to move past that by implementing an online program so people can access information.
These programs, specifically the opioid public health crisis that we have, is about everyone having the same piece of information so that we don't have to keep having the summits, but instead we're all on the same page. Community, here we are.
Thank you cards she received from 9th grade students show her taking action is what makes a difference.
Honestly, the day you came, I was thinking of going back to doing pills. You coming really helped me see that there are other ways to deal with depression. See, that is like one potentially life we change, and I don't care about the rest of it.
For Indiana Newsdesk, I'm Lindsay Wright.
Trump says the policy plan that will be rolled out will be a strong one. Other national departments say they're working more than ever to crack down on illegal drug trafficking and preventing drugs from entering the country in the first place. Now for headlines, we go over to Lindsay Wright, who has the latest on this week's top stories.
Thanks, Joe. A new analysis by the Centers for Disease Control and Prevention provides further links between syringe services programs and preventing HIV. Syringe exchanges distribute needles to injection drug users and provide services such as HIV testing and treatment information. The CDC surveyed injection drug users in Scott County, which set up its exchange after an HIV outbreak in 2015. They found over half of people who had taken an HIV test did so after the program was put in place. About 21% of respondents said they got tested at an exchange site.
Most people who responded to our study had tested at the syringe service program, but that's one of a total of about 10 different testing settings or testing opportunities that were available and utilized by people.
More than 200 people in Scott County have tested positive for HIV since a state of emergency was declared in 2015. The exchange is credited for slowing the spread of HIV and hepatitis C. Indiana University is launching a new center aimed at supporting rural communities. The center will provide opportunities for faculty, staff, and students to focus on the problems rural Hoosiers face. The center will collaborate with community leaders and residents to create projects that improve health, environment, and arts and culture.
This is an open system driven by purpose. Everyone is invited to be engaged. When we all share a dream of thriving rural Hoosier communities, anything is possible.
Leaders will focus efforts in the southwest central areas that includes Brown, Greene, Lawrence, Monroe, Orange, and Washington counties. Projects will kick off in Orange County this fall. Brown County is taking community input before spending a $1,500 grant from Indiana's Office of Community and Rural Affairs. Officials say the county struggles to retain youth residents after they graduate.
But there is this problem that there's no place for them to work if they stay here.
The county surveyed more than 400 residents about projects they think the money should be used for. About 40 residents turned out for a community forum this week to discuss those results. The county will take all the feedback into consideration before making a final decision in the coming weeks. A medication-assisted treatment clinic is set to open in Bloomington this summer as part of a statewide expansion of addiction treatment. The state will open new medication-assisted treatment centers in 5 counties, and Indiana's Medicaid program will pay for methadone treatment. There are already multiple addiction service options in Monroe County. The new methadone clinic will serve as another option for residents.
One of the things that we're really hoping to do is really to engage all of those community partners. So look at all of those individuals that are out there driving care so that we can really kind of lock arms with each other.
The state selected the 5 counties based on need. The other participating counties include Allen, Johnson, Vigo, and Tippecanoe. Purdue University has received final approval for its controversial acquisition of Kaplan University, now known as Purdue University Global. The deal has been marked with controversy since it was announced almost a year ago. Faculty members worry the online platform will tarnish Purdue's reputation and diminish the value of a Purdue degree. But University President Mitch Daniels says it's a way to increase education access to adults. About 30,000 Kaplan students will transition to Purdue Global. Officials expect to launch the new program in April. The Monroe County Community School Corporation is opening up the conversation about school safety to the public. The district hosted 2 community forums earlier this week. MCCSC currently conducts monthly safety drills at its buildings, but Bloomington North student Peggy Smiley says more needs to be done to protect students.
We are scared every day coming to school, but with all the safety and with all the clinicians that Mr. Akers and Mr. Dibro have done for us, we are thankful for it, but it's not enough. It's never enough until we are sure that 100% it will not happen.
Officials say the corporation is making changes like implementing cameras in all MCCSC facilities and transitioning away from traditional locks to badge readers. Superintendent Judy DeMuth says they will not implement metal detectors or armed school security guards or teachers. Indiana has the largest voucher program in the nation. It allows students to use state money to pay for tuition at non-public schools, but a report shows growth for the program is slowing down. Participation increased by about 4% in the 2017 school year. That's down compared to a 12% increase in participation in 2015. And Joe, voucher applications for the 2018-2019 school year close on September 1st.
All right, Lindsay, thank you very
You're
much.
welcome.
And coming up next on Indiana Newsdesk, roads in rural Indiana are damaged to the tune of thousands of dollars a year. But these aren't your ordinary potholes. Coming up, we'll look at how the Amish community is working with officials to lessen the damage their horseshoes do to the roads in their area. And some students in Brown County are getting a hands-on education in design and engineering, but learning how to thrive in a modern workplace may be the most valuable lesson. These stories and more right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
$10,000.
15? 15, you think?
20, 21,000?
600.
20. 18.5.
24.
It's at least 40.
Look at it.
4,500,000.
650.
20.
650.
This textile would be worth about $500,000.
$500,000?
No way.
I knew it. It's just a blanket.
Laying on the back of a chair. Well, sir, you have a national treasure.
Wow.
A national treasure. Congratulations.
I can't believe this.
Welcome back to Indiana Newsdesk. The 2018 legislative session ends next week, and as usual, that means there's a race to the finish. Let's take a look at where things stand. A bill that would address the state's school funding gap is close to the finish line. Now, it would make up to $25 million from the state's reserves available. The funding shortfall is estimated at more than $22 million. After some changes, lawmakers are expected to submit a final bill in the next couple days. And another piece of education legislation aims to remedy the state's teacher shortage by allowing public schools to fill up to 10% of their teaching staff with unlicensed teachers. The bill doesn't require districts to hire unlicensed teachers, but it does give superintendents and local school boards the option. A conference committee is scheduled to take up the bill again next week. State lawmakers are arguing over labeling and testing requirements for cannabidiol or CBD manufacturers in the final days of the 2018 session. The Senate put labeling and testing requirements into CBD legislation, including a provision to require all manufacturers to submit their CBD oil to an independent lab for inspection. Both chambers will have to vote on the bill once more this session for it to pass. A bill that would require medical providers who treat women for complications arising from abortions to report detailed patient information to the state is awaiting the governor's signature. Supporters say it's necessary to make sure abortions are performed safely. Meanwhile, opponents argue it will allow big government meddling in personal affairs. At least 20 states have similar laws on the books. A bill the governor signed yesterday aims to lower the state's infant mortality rate. The measure creates a system to help expecting mothers identify the facility that can best deliver the level of care they require.
We're going to connect them with the correct, appropriate level of care that they need.
According to the Centers for Disease Control and Prevention, Indiana has the 7th highest infant mortality rate in the country and the 5th highest maternal mortality rate. The legislation goes into effect July 1st. The Indiana House approved legislation Monday to ensure DACA recipients can receive job licenses. DACA recipients were barred from those licenses after a recent change at the state's professional licensing agency. Now, that change brought the agency into compliance with a 2011 state immigration law. The bill ensures dreamers who are legally allowed to work by the federal government don't face barriers at the state level. A feticide bill is also on the governor's desk. It would allow prosecutors to seek a murder charge against someone who attacks a woman and causes the death of her fetus. Current law allows such charges if the fetus is viable. The legislation eliminates the need for viability. A bill that standardizes the way coroners report drug deaths is poised to become law. In the case of a suspected overdose, coroners are required to test bodily fluids for controlled substances and report results to the State Department of Health. The bill also opens up some funding to pay for toxicology screens. Lawmakers hope the measure will result in better data that can help policymakers tackle the drug epidemic. A bill that would connect Hoosier veterans with hyperbaric oxygen therapy is advancing at the State House. A Senate committee heard the proposal this week. The therapy is the medicinal use of pure oxygen to heal. The bill makes changes to a pilot program and expands access to more veterans. If passed, veterans could start receiving treatment this summer. And the legislative session wraps up next week, so we'll find out what happens with some of these bills in future programs. Several Indiana counties are spending hundreds of thousands of dollars each year to repair major road damage, and the source of some of those problems presents a unique challenge. Reporter Barbara Brozier has more from Elkhart County.
Joe, we're in Middlebury, Indiana, which is often referred to as Amish country because of the large population here. Now, the Amish are a huge economic driver in this region, but the buggies they use every day are causing some major damage to roads. Elkhart County is one of several across the state grappling with how to address that issue while also trying to respect the beliefs of the Amish. People drive from all over Indiana to indulge at some of Middlebury's Amish restaurants or browse through some of the shops.
It's a big thing for tourism, but they also supply a lot of labor for our recreational vehicle industry. We have a pretty significant cabinetry and furniture business as well.
That large Amish population means you see a lot of buggies passing by, and you may feel a difference when driving down these roads yourself.
So this actually started last year. And some of this damage just appeared this spring.
Yoder says at least half of Elkhart County's roads have some damage from horseshoes. We spoke to several members of the Amish community, but they didn't want to do a recorded interview. They say it's necessary for their horses to wear heavy-duty horseshoes because they keep the horses from sliding when roads are wet. They're especially important in this part of the state where there's a significant amount of snow every year. But repairing the damage is expensive. Elkhart County charges a $55 annual buggy plate fee, but that money doesn't go very far.
LaGrange County is up to $100 a buggy, and I think we are going to increase our plate as well. But that generates maybe $140,000, $150,000 a year. And when we repave a mile of road, that's close to $100,000. So, we can't do a lot of work.
It's the same dilemma facing communities across the state. Orange County is home to a smaller number of Old Order Amish. Richard Dixon is president of the Orange County Commissioners. He says horseshoe damage has always been a problem, but recently it's gotten worse.
With the new Indiana Crossroads grants, we're doing a lot more hot mix asphalt paving. And I think the damage is even more pronounced on the hot mix asphalt.
County leaders here met with members of the Amish community to come up with solutions that would work for both parties. The Amish agreed to use less abrasive horseshoes for half of the year and use heavier duty models during the remaining months.
We've talked about rubber shoes. The problem with rubber shoes are that they don't last long. They don't wear well.
Well, right into this area.
Those are solutions Yoder says they might eventually consider in Elkhart County as well, but they could provide additional challenges.
The problem with regulating horseshoes is that somebody has to enforce it, and our county sheriff has been reluctant to pull over buggies and lift a horse's foot to check on the horseshoes.
So Elkhart County road crews will stay busy, patching up and repaving horse troughs that keep reappearing on roads. Yoder says it's something residents only complain about a couple times a year.
We've become accustomed to the Amish and their traditions, and so it's not really a major issue for us, I guess.
Now, this isn't an issue that's unique to Indiana. Earlier this year, a Wisconsin legislator actually proposed a bill in their state house that would have banned the use of horseshoes with spikes for 6 months out of the year. Folks in Indiana I've talked to, though, say they think this is an issue that's best left up to local governments. Reporting in Elkhart County, I'm Barbara Brozier for Indiana Newsdesk.
Thanks, Barbara. Brown County students are getting hands-on experience in the world of business. As Tyler Lake reports, a program that lets them manufacture and sell products to the community will expand in the fall.
Inside a lab at Brown County High School, there's a new type of learning happening.
We started with 3D printing. We did that for a while. Then we moved on to the vinyl cutter.
Rourke Ireland is the sole employee of Eagle Manufacturing. It's a student-run business at the high school. Ireland likes working with his hands and makes everything from headphone cases to vinyl wall graphics. Most of what he makes is used by the school or sold in the community.
I really enjoy the vinyl. It's really cool to see stuff that I made up in the school, like at the technology department, pretty much all that stuff I made.
Eagle Manufacturing is part of the Regional Opportunities Initiative, which aims to promote economic prosperity in southwest central Indiana. Local leaders hope it will help bridge the gap between the needs and the workforce of the region.
So the Southwest Central Indiana region needs advanced manufacturers. Whether students are coming straight out of high school to the workforce, they're going to a 2-year institution like Vincennes or Ivy Tech, or they're going to a 4-year institution where they may obtain an engineering degree.
The program works with businesses all over the region to give students the opportunity to work in 4 different areas: engineering design, graphics, CNC machining, and administration. Students use industry-scale machines and state-of-the-art equipment to perform tasks like laser engraving, 3D printing, and CNC milling. They also have community mentors that will help the students produce parts for everything from robot prototypes to t-shirts. The goal is not only to give students the necessary technical skills, but also soft skills that set them up for success in the real world.
They need employees who will show up on time, who will be willing to go the extra mile, who will take instruction, who have problem-solving skills, critical thinking skills, and can just interact with people and collaborate with people and get work done.
The workforce at Eagle Manufacturing will expand in the fall. Junior Sam Bowman says he's excited to get hands-on experience before going off to college.
I've always been kind of interested in like machining and such, and this is just kind of an opportunity for me to get to learn a little more about that, but not only just the machining aspects, also like kind of the aspects of like running a business, doing the finances, marketing, all that kind of stuff. It just kind of like brings all of that together.
For Indiana Newsdesk, I'm Tyler Lake. And Paoli has a big vulture problem. After struggling to find a solution, local officials say they might now have a fix. Animal Control Officer Justin Burton is waiting on a permit from the DNR to allow him to hang dead vultures from prominent roosting trees in Paoli. Burton says he hopes to have all the necessary permits secured by May. And that's the end of this program, but the news continues online as we cover South Central Indiana at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber, the Gigacity Company, fiber internet, HD, and digital IPTV in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis, lawmg.com. The IU School of Education, preparing teachers, scholars, and administrators to improve teaching in Indiana and around the world. education.indiana.edu. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. alumni.iu.edu. The Radio and TV News Endowment, a fund established by listeners and viewers to sustain reporting of Indiana news. More information at indianapublicmedia.org/support. And by WTIU members. Thank you.